My experience with concussion started when I was 13 years old. It was the summer of 2009, and I was playing in the state development camp for Massachusetts, and I was skating towards the net, and I didn't see the girl coming out of the corner, but from what my teammate said, she hit me, and apparently I flew up into the air and landed on my head. So my last concussion occurred when I was a freshman in college, and it completely changed my entire life. I had to move home from school. I couldn't go to college anymore. I wasn't working. I was really just in my room in the dark for months on end. During my hockey career, I was diagnosed with 4 documented concussions over the span of about 7 years, but they think that I could have had anywhere between 8 and really 20 concussions.
It's when you have a patient that comes into the facility and their life has been completely devastated. I mean, you have to think about somebody who was highly functional, a great athlete, an academic, honor, becoming anything they want to be. And then all of a sudden they're at a crossroad in life where they can't hardly get out of bed. And every doctor they go to is giving them answers, telling them that they don't know what's wrong, they should be recovering, things should be okay, but they're not. So the patient gets labeled as a malingerer or crazy or just needing attention. But what really was going on is there was a physiological process. There was an ongoing concussion, and that's what we see with Colleen. She finally got some help to restore the neurological harmony that she needs in her brain.
Dr. Brock was phenomenal. He was the one doctor who believed all of my symptoms and justified them, and he really pinpointed exactly what I needed to work on, what my deficits were, and how we could improve them. Slowly as the week progressed, my mom, who was with me, started to see improvements, and it wasn't really until that Friday, my 5th day here, that it clicked that I had improved so much. Things that I couldn't do at the start of the week, I was mastering at the end of the week. And I went from not being able to sit up for more than 4 hours a day to being able to live a normal life. I was able to go back to work to the point where I was running a youth hockey program, and I was able to help out my neighbor with her children and spend time outside of my room with my family and with my friends. Before I came to Cerebrum, I had little hope for the future. I thought that I wasn't really going to be able to do what I wanted to do. I thought that I was going to have to accept where I was and never fully recover and never get back to my old self. But by coming to Cerebrum, they gave me that hope that I can do what I want in the future.
In the end, Colleen has seen improvement that is absolutely astounding, and now she has light at the end of her tunnel. It's bright with the future of being able to learn, to be able to think, to be able to move, to be able to get up, to be able to have family, to be able to do the things that most of us take for granted.
Yes, Cerebrum isn't traditional medicine, but it works. It's not a fantasy, it's a reality that they are changing lives every single day. I've seen it in myself, I've seen it in so many other patients, that they are making them better.